welcome to Aesthetic Insider Radio. This is your host, Angela O'Mara. Today, we're going to talk about cosmetic surgery after pregnancy, after weight loss, and after other life-changing situations that might lead a patient to look to a cosmetic surgeon to really help improve their appearance. In this insightful interview with Aesthetic Insider Radio, Dr. Irene Tower, a cosmetic surgeon who practices at Inland Cosmetic Surgery in Rancho Cucamonga, will discuss how her expertise is really helping patients regain a pre-pregnancy body and help with those that have extreme weight loss and other things. Dr. Tower, welcome to Aesthetic Insider Radio. It's a pleasure to have you on the show today.
Thank you so much, Angela.
Absolutely. Well, Dr. Tower, before we kind of go into questions about talking about all these wonderful cosmetic surgery procedures that you do perform and how you help patients. I'd love to hear a little bit more about yourself and let our listeners, just what it is about Inland Cosmetic Surgery and your position there as a leading, cosmetic surgeon and practice.
Yeah, so I've been in practice now in Southern California for about 9 years. I have not always lived here. I came from Texas and then did some training in Pittsburgh, so I've kind of been all over the country. I have 3 beautiful children of my own, and they are the light of my life, but it really gives me a good understanding of the changes that women's bodies will go through during pregnancies and childbirth, and those type of changes can really affect the way a woman feels about her body. So that's one of the things that I love to do here at Inland Cosmetic Surgery is really help mommies and help them get their confidence back, their bodies back after having had, all their children. So,
would you say you're kind of like typical patients that would need body contouring procedures?
Well, we look at anyone that's had excessive stretching of their skin. So that would be a pregnancy where, when the skin elasticity gets to a certain level and it gets destroyed by stretch marks and things like that. Once, that stretching is gone, that skin doesn't go back. It doesn't have the elasticity it once had. And so it starts to hang. And this is something that people feel self-conscious about. So this can happen from pregnancies. This can happen from massive weight loss. And we're seeing so many weight loss surgical procedures, the gastric bypass, the gastric sleeve, that's very common, that a lot of people are losing a lot of weight, over 100 pounds of weight loss. And skin really just has a hard time recovering from that type of volume loss. It just will not retract back to normal. So it leaves you with a lot of extra skin. So, with women who've had just children and have kind of maintain their weight throughout their life, it may just be that they need, a breast and tummy procedure, because those are the 2 main areas that will change during childbirth and pregnancies. For someone who's had massive weight loss, and you have to address their entire body, because now their arm skin may be hanging, their neck may be hanging, their breast, their tummy, their buttock, their thighs. So we kind of can address we kind of look at the 2 patients a little bit differently for the most part, but that's kind of the difference between the 2. So with mommies, it's mostly going to be a breast and a tummy procedure that needs to be addressed, and then with massive weight loss, you kind of will address the entire body.
Well, let me ask you, because I've heard the term mommy makeover. Is that something that kind of is that a term you use? And with a mommy makeover, does it just include a breast augmentation, a tummy tuck? Are there any other procedures? Does it depend on the patient? I have loads of questions. you can tell.
Mommy makeover is a very general term, and we use it for any combination of breast and tummy procedure because that's kind of what will take a toll during pregnancy and childbirth. So there could be it's very individualized per patient. So a patient may come in with adequate breast tissue that just seems to be hanging. So we would offer her possibly just a lift, and she wouldn't necessarily need an implant per se because she has the volume still. And then maybe she has a little bit of loose skin on her tummy, but not a lot, not enough to really need a tummy tuck, and her muscles are in good condition, so maybe she just needs a mini tuck. So you could do a breast lift and a mini tuck, and we would still call it a mommy makeover, but it's just because it will encompass both the breast and the tummy. So there's so many variations to what we would call a mommy makeover. So when people ask, "What is it?" It's basically any breast and tummy procedure that you would do together to help improve the appearance of the two.
Now, interesting. So now, what is the difference between a mini tuck, a mini tummy tuck, and a regular tummy tuck?
Really sure. So when we are talking about extra skin, we try to evaluate all the different quadrants of the abdomen. So some people just have a little extra skin at the bottom. So so when I mean bottom, I'm kind of dividing it by the belly button. So when we look at the abdomen, if the skin above the belly button looks good, it's nice and tight, there's really no issues there. The muscles seem like they're in fairly good position. They're not too distended from what we call separation of the muscle that we get from childbirth at times. If all of those things look okay, but she's got some loose skin at the bottom, or maybe she has a C-section scar that's now created this kind of almost an indentation with a little bit of skin over it. This is a very common concern with women with C-section. They don't like that. So we can offer a woman like this a mini tuck. So a mini tuck will just address the skin at the lower portion of the abdomen. So you're not really getting the muscle tightening. You're not going to be getting a new belly button. So it's just going to be basically removing the extra skin at the lower portion of the abdomen. The nice thing about doing a mini tuck, and we will offer it to people sometimes that are carry a little bit more weight in their tummy. So we can do more liposuction of the entire abdomen when we're doing a mini tuck, because we're not moving as much skin, and we're doing a little bit less work underneath we can be a little bit more aggressive with taking a little bit more fat.
Okay, that makes sense. I would imagine it depends on the person, and even in the case of perhaps pregnant women with multiple children, perhaps they've had a little, twins, triplets. I would imagine they get a little bit more muscle stretching than
Exactly.
the regular.
When you have that muscle stretching, and you have loose skin above and below the umbilicus, sometimes even the belly button will develop an umbilical hernia. On women like this, a full tummy tuck is what we would recommend. So in a full tummy tuck, we remove all the skin below the belly button. It gives us access to all of the muscles, which we plicate down the midline. So we repair all the muscles down the midline, and then we pull that skin down, and then it allows us to recreate a new belly button. It's still your belly button, but we just put it through a new area of skin now that we've pulled everything down. So when we do a full tummy tuck, we can't, like I said, we can't do as much liposuction. So we're limited to the waist. So we can't be doing too much aggressive liposuction because it's too damaging to the tissues. And because we've already done so much work to lift and pull and plicate muscles, we have to be a little bit more conservative with that.
Okay, that makes sense. And then let me ask you, in terms of how long after having a child would you do patients come for a mommy makeover?
There's really no certain point where I say you shouldn't or should not come in, but normally about 3 months. And you have to be at a point where you're pretty sure you're not going to have more kids.
Yeah, that was going to be my next question.
Yeah. So you really should be, okay, I'm done with having children, because there's really no point. I mean, to do all of that work and then have another pregnancy. It happens. I mean, we've had it happen before. And usually, patients surprisingly don't stretch out quite as much as they did the first time. So it's they do bounce back a little bit better after having had a tummy tuck and then gotten pregnant. But I mean, overall, it's ideal to be done with having children and at least 3 months after, and you have to not be breastfeeding anymore. So if you are breastfeeding and you want to have a mommy makeover, we do like to see that the breasts are dry for about 3 months, or else it kind of puts you at higher risk of infection.
That makes sense. Well, and then how would you say with patients from, like post-pregnancy patients, in terms of recovery and in terms of age of patient? Is there any difference? Is there, smoother recovery, longer recovery? Because we do have kind of quite a lot of, mommies that are, not in their 20s, they may be in their late 30s, early 40s. So is there any significant difference there?
It's not as much of an age thing I've seen as much as it is just general health. So women that tend to eat healthy and exercise and really take care of themselves, and keep up with their protein intake and their diet is very healthy, and that's what's really going to make the biggest difference in terms of good recovery and speedy recoveries. The other thing that I kind of have noticed is patients that add a lot more procedures. So if you're adding to your mommy makeover liposuction of the entire back, liposuction of the thighs, you've kind of now added several other levels of work to be done. It can kind of slow things down because your body now has to recover from that much bigger of a procedure. So, but normally a breast and a tummy mommy makeover, they recover very well. And usually, within 3 weeks, they're feeling pretty well going back to most of their regular activities. Now, I wouldn't say if you're someone that does extreme type of workouts that you're going to be doing that in 3 weeks. But, most of your daily activities will be, attainable around 3 weeks after surgery.
Now, talking about workouts, I did notice on your website there's an amazing photo of you as a competitive athlete and bodybuilder. And do you feel that you're, because of your nature, athletic nature, that it has helped you with an understanding of body aesthetics, kind of influence you as a surgeon and as an athlete?
I feel like all of that kind of plays into it. I mean, when we're working to improve your own body, you become so aware of the muscles and how everything looks and proportions, and it's just a new awareness when you're trying to achieve something for yourself, and now you're trying to achieve it for, my patient. So I feel like they go hand in hand. I feel like I have a good understanding, but everyone has their own ideal body aesthetic. So I am not going to push my body aesthetic on any certain patient, because some patients don't want to be muscular and lean. That's just not what they're looking for. They want to be curvy and round. So we try to just accommodate what, someone else's ideal is for themselves rather than, what I feel my ideal is for myself. So you have to be flexible. You have to understand that cultures and just the way you feel about the world changes how you see your body and how you want to look. So I think that's kind of the most important thing, is just kind of having a very artistic eye about it, but also being very flexible and understanding that everyone's going to want their bodies to look in a certain way. And then you have to just, give them their realistic expectations as well, because some patients want the universe, and you really can't deliver and some things that people want. So we try to come to a real good understanding of what is achievable with surgery.
That makes sense. Yeah. Now, one of your specialties I know is body contouring, and in helping people who have had the significant weight loss. So when you see a patient after they have, I guess my question would be, what would be the highest weight loss patient that you have done body contouring and cosmetic surgery procedures on? Like you mentioned earlier, like 100-pound weight loss. Would that be the highest, lowest?
I'm not sure exactly what my highest and lowest. I know we've had patients up to 200-pound weight loss. And, even patients that have lost 50 pounds at times, just a smaller weight loss, still can have a degree of skin laxity that they're unhappy with. It's just probably not as global of a problem on their body. It just may be their abdomen. And it depends where people carry their weight. Some women, carry their weight in their thighs. So when they lose a lot of weight, maybe their tummies actually don't have as big of a problem as their thighs do. And so we would first possibly address the thighs. And really look at them and see how we can improve the skin quality of the side. So everyone's very individual, how they gain and how they lose and where they carry their weight. Men a lot of times will come in with that have had severe weight loss. They usually carry it in their abdomen and in their back. And so a lot of men with weight loss, we really require a full body lift, which would be taking skin from the back and taking skin from the front and doing a full tummy tuck. And that really gives a better contour for them rather than doing just the abdomen. Another thing that we see with extreme weight loss is, even for men, is, sagging chest, and they have a lot of skin, and then they will require a lift just like you would do almost for a woman. I mean, you adjust it to the male chest, but you still have to remove extra skin because they've had so much, fatty tissue there that now that they've lost it, they want to have that nice, tight chest that, they're working so hard to achieve. So there's lots of areas of the body that you have to individualize and kind of take piece by piece. And a lot of times when you've had patients that have lost like 200 pounds, you can't do everything in one surgical session. It just is not feasible. So we usually will split it up. We'll give patients options of what makes sense and what surgeries would go together better, and allow them to have, nice, good recoveries and the best aesthetic outcome.
Yeah, that's really interesting because I'd never really thought about the difference in, just like you said, how some people have weight in different areas, but the kind of very specific difference of, women gain, some women gain more weight in their thighs, some men in their backs, and the overall, result you want is to give their body as much balance as possible.
Yeah.
Yeah. Would you say, in terms of, the reaction of a patient with extreme weight loss after, they've gone through this life-changing surgery, how do they feel about themselves? Do you see it changing in their attitudes in their life?
You mean after having had weight loss surgery or after having skin removed?
Yeah, actually both.
Yeah, so both. So, when they come to me and they've had the weight loss surgery, they feel better, like health-wise, they feel better, but they really have such a general disappointment at the way their body looks. They almost sometimes have told me, I liked my body better, I think, when I was heavier because at least my skin wasn't hanging, Now you're dealing with an entirely new problem, and it's, just as uncomfortable for them as it was for them to be heavy. I mean, they feel better, they want to go out, they want to be active, they want to maybe start dating or doing other things, but they're so self-conscious about the skin that's hanging, and it really kind of almost paralyzes them in this place where they're like, gosh, I worked so hard and I've gotten to this point and now I've got this, and it's a struggle for them. So we really try our best to address everything. And, unfortunately, like, patients a lot of times have to pay out of pocket for a lot of these things. And insurances won't always cover skin removal. They consider it more of an aesthetic problem. So a lot of people have a hard time just being able to afford it, So we try to work with patients, try to see what we can get their insurances to cover. A lot of them have skin that hangs extremely low and they have rashes and other issues. And so if it becomes a medical problem and they're now having infections and rashes because of the extra skin, it kind of sometimes will help us out and helping them get the skin removed, but they struggle. So they really aren't happy necessarily. So once we've done the surgery and we were starting to work on removing the skin, they transform. They are my most grateful patients. They really, I never hear any complaints from any patients that have gone through this. They're just so extremely happy. They're so ready to move on with life. They have like a new outlook on everything, and just, they tell me over and over that I changed their life. They really did it themselves, and I was there and I helped out, but they are very grateful, and it's really so rewarding for me. So that's why I really like working with patients like that.
You know, what I think is great is, when I hear you say, well, they, first off, they feel, they want to lose the weight, and I'm sure they have an ideal of how they will look after they lose weight. And then, they have this huge weight loss, and which, like you said, they've worked extremely hard to lose that weight, and whether it is through diet and exercise, whether it's through a bypass, a gastric bypass, or whatever procedure, they still have worked really hard to get to that point, and then that disappointment in the middle of, oh, well, I don't actually look like I thought I would,
Right.
and then you are the one who then gives them probably that vision of themselves, what they had after cosmetic surgery, which I can understand how very grateful to you they are, which is amazing. Yeah, yeah. Now, with obviously there's we have about 10 minutes left on this show, and we've talked about mommy makeovers and procedures for moms, and we've talked about weight loss or more extreme weight loss patients, but I do understand, there are other people who have other body cosmetic surgery needs that aren't necessarily moms, and they aren't necessarily extreme weight loss people, but for the person out there who perhaps have a breast issue or a tummy tuck, a tummy issue, or just my butt doesn't look as good as I'd like it to. What are the more general procedures that you perform, and what types of patients come through your practice?
Yeah, so now we're seeing a lot of patients, and social media is playing into this a lot. And this new aesthetic of people want very small waist and very chiseled abs, and they want, very round buttock. And a lot of these things aren't necessarily achievable without one, very, very good genetics, or two, just kind of, it can't be achieved, you can't achieve that at the gym, So they turn to us to kind of recontour their body to give them more ideal shape for themselves. So, again, genetics plays a huge role in the shape of your body. So some people are so frustrated, and, they just carry weight in their tummy, and they just can't seem to, get rid of it, but they're fit, they're healthy, and they work out. So they may be a really good candidate for liposuction. Their skin quality is still good. They just want a little bit of the fluff that's around their abdomen to be trimmed up, and they're just struggling to get it off. And this is very common. We see this in men and in women. And so another very common procedure I do is something called high definition liposuction, where we do liposuction of the abdomen and in the back, and we start to kind of define the muscle. So when people are athletic and they want to see a little bit more muscle definition, liposuction can achieve that. It's called high definition liposuction. We accentuate the musculature in the abdomen. And so you could have a nice trim abdomen. And for the most part, if you maintain your weight, it becomes easier and less of a problem area for patients that have had liposuction in an area. So if it's been, if it's an area that's always just very difficult for you to lose from, that's a great area to have liposuction. Just kind of take it off the table. It's not as much of a problem, and you can kind of focus on feeling good and healthy about your body and not constantly struggling with that one area. So that's a good ideal patient for liposuction. Other people just want to be more feminine. So maybe there's a young girl that doesn't, has absolutely no breast tissue, and she just wants to have a little something, be a little bit more what she would consider to be a more feminine body, and we can do just a breast implant. And, that's a very common procedure that we're doing. Some women just want a breast lift, and that could be a problem just with aging. It could be even a woman that's never had children, and her breasts now are not as perky as they used to be when she's 20, and now she's 50, but she still wants to enjoy her life in her breast. And so we should just do a breast lift where we remove extra skin, but not necessarily have to do an implant. So another one that's very common right now is the Brazilian butt lift. So, everyone wants a little bit rounder, fuller butt. And again, it's very hard to achieve the looks that we're seeing out there with squats. It's just not happening. So we liposuction. So you have to have some fat on your body in order to do this. You can't be a rail and come in and want fat transfer because it just won't happen. But most people will carry enough weight on them to where we can do liposuction of the abdomen and the back. And we take that fat, we've harvested it in a very kind of gentle way, and we place it into the buttock. And it creates a nice curvature, and it's very natural looking as long as you don't overdo it. But it's a very nice way to enhance the buttock without it, it doesn't have to look overdone. It can look very subtle and just help kind of redistribute the weight in the body and give a little bit nicer aesthetic.
We have about 4 minutes left on the show, and so I would like to ask, in terms of these procedures, which I love it that we're talking about trends, or current trends in, like the Brazilian butt and the liposuction. But I would like to just ask you, briefly in terms of the trends. Where do you kind of see cosmetic surgery going now? Do you think, we have reached, a time in our practices where, we're pretty much doing all the procedures possible? Are there any new things on the horizon? Are there any other trends that we haven't discussed?
It goes with the time. So, cosmetic surgery will constantly adjust itself. I don't think we're reinventing the wheel at any point. I think there's always room for improvement. Right now, a lot of women are having their breast implants taken out and just getting a lift, going more towards a more natural type of body appearance, kind of accepting where their body is and wanting to look more natural. So we're kind of seeing a little bit of that starting to happen as well. So we kind of adjust with the times and what people are requiring and demanding. And we always keep up with literature and, the latest and greatest of what's kind of coming out there to allow us to get better results for our patients. I mean, there's always like little issues that sometimes can plague, cosmetic surgeons, because a lot of times we're dealing with, putting foreign bodies into people, like the implants. And anytime you're doing that, there's, scar tissue and different types of things that we deal with. And, I think advances towards, how to prevent certain complications and certain other risk factors that come in with that is kind of what we're still constantly working on and to improve and make better. I don't think implants are ever going to go away. I don't think there's certain things that are kind of tried and true and will continue to happen. But like I said, it goes with the time. So the trend right now is a very curvaceous figure. Maybe in a couple years, we'll kind of go back to how it was in the 90s, where everybody wanted to be rail thin, So it just kind of depends, and we adjust. And for the most part, we're flexible with what people want, as long as it's safe and not unrealistic.
Yeah, and I think it's great, as you say, you can accommodate each patient and understand that each body is different. So, a rail thin person isn't going to have that curvaceous body, or at least not easily, and understanding the safety issues, with that request. We are kind of wrapping up the show, and I know our listeners, would, really want to know how they can get in touch with you. And so if you wouldn't mind just telling our audience, the best way to reach you for any questions they may have.
Yes, absolutely. We're at Inland Cosmetic Surgery. My name is Dr. Tower, and our website is www.inlandcosmetic.com. You can also call the office. The office number is area code 909-987-0899. And I know if there's anyone that, is in Instagram, I do have a Body by Dr. T. You can see a lot of my before afters. And then my personal page is Tower Power MD. So, you can find me there, and it has all of our information as well.
Well, Dr. Irene Tower, thank you so much for being on Aesthetic Insider Radio. I'd love to have you back on the show as a guest and maybe discuss, one of the things I feel is leading by example. You are fit, you are healthy, you're a beautiful, wonderful surgeon, and I'm sure you inspire many of your patients to really, live the best life they can.
Oh, I appreciate you saying that. No, thank you so much. It was very nice being on the show. I appreciate you very much.
Absolutely. We'll have a great day.
Okay, you too. Bye-bye.
Bye-bye.